I know this is a very hot topic right now about dental implants, all-on-4 versus 3-on-6. In the last few years, I've had multiple patients that keep on asking me in my YouTube comments about all-on-4 versus 3-on-6. Which one's the better solution? Well, we in the industry like to call them FP3 versus FP1. And my goal here in this video is to help explain those main differences for you. Now, we recently had an opportunity because we have a new employee that just started with us who knows nothing about dentistry, and she needed to get a few teeth extracted. I thought this would be a great opportunity for her to go and film herself while she does her first research about the topic so that she could ask some questions. And my goal is to watch this video and answer as many of these questions because hopefully some of these questions that she has are going to be very similar to the questions that you guys have. My name is Dr. Daniel Choi, owner and doctor here at North Texas Dental Surgery. We do a ton of dental implants here, so I want to make sure that patients have all their questions answered and we can help as many patients out there. So let's head straight into the video.
So my name is Cassidy. I am 23. I'm a smoker. I have genetically bad teeth. I did just have a molar back here pulled because it was just falling apart. I have a crown in front of it, and I have two teeth over here that have a huge cavity. They were filled, and then the filling fell out. So tooth sensitivity, pain, and stuff like that. So today I'm going to be looking at all-on-4 dental implants or 3-on-6. What is the difference, and what would be the best option for me? And then at the end of this video, I'm going to be asking Dr. Choi these questions as well. So the first thing I want to do is look at what is the difference between them. So right here it's saying both options give you fixed non-removable teeth on implants. The difference is that with 3-on-6 you get only teeth, and with all-on-4 you get teeth and artificial gums. So for patient eligibility for a 3-on-6, very few people meet the criteria to be a candidate for it. In order to be a candidate, you need to have bad teeth that need extraction, but at the same time have jawbone that's in pristine condition, and that is a combination that very rarely happens. Because if you have bad teeth, that bone is already like deteriorating.
I don't know what website she's reading right now, but I think a very important point is that a lot of the information that you're going to see right off the bat when you're going online is going to be biased. My goal with this video is that we do dental implants for implant bridges, we do implants for single implants, we do implants for all-on-4s, snap-on dentures, and you know, every case is a case-by-case basis. So what we tell patients is, listen, we have no incentive. You know, my goal here is like, I tell people like, listen, I want the best solution for you, and everybody's mouth is very different. So what she's doing right now, she found out a little bit about the fact that she hears that whoever case actually has to be, like, their bone has to be in pristine condition, right? And so that's a very valid point, because whenever we're doing your dental implants, your bone and your gum dictate the aesthetics of your case. And when we're going and we're taking all your teeth out, you know, assuming that you have all your teeth, it is very difficult because everybody has different types of volume of bone, thickness of bone, what we call biotypes, where every patient is not created equal. And so, long story short, when we're placing these dental implants, it becomes much more technique sensitive, and we have to be very, very careful of how we place these dental implants to make sure you have an ideal outcome. Now, here's the other issue. Even if we are super careful, what actually is, you know, she's actually catching this, you know, at a really good point. I mean, she brings up a very valid point. She's making the assumption, wait, if my teeth are not in good condition, what makes my bone be in pristine condition? And she's absolutely very correct with that, because if your teeth have large cavities or root canals or crowns and the teeth are just not in good shape, getting those teeth out without doing damage to the surrounding bone is going to be very difficult. Also, if you have a history of periodontal disease or just bone loss because you're older in life, then yes, you do not have ideal bone, and so therefore you are not going to be an ideal 3-on-6 candidate. And what else is there? Again, the biotype being the factors that can have a significant impact in regards to whether you're a good candidate for either. So, and also one other thing I wanted to say that is, if you may even have a majority of your teeth, but if you've even lost a tooth a few years before, you're going to have a lot of bone loss in that area. And any sort of bone loss or whatever is just not a good candidate for an FP1 / a 3-on-6 type of patient. So Not sure like how she found that out, but she just made the proper assumption, meaning that if her teeth is not in good shape, then she's assuming that her bone's not in good shape. But I did want to say one other thing is, be careful when you're doing your research, because I do find that a lot of providers, whether they may try to push one procedure versus the other. I've even seen some comments in the past where people are saying that, hey, you're trying to push one procedure versus the other because it's easier. We're not trying to push one procedure versus the other because we're going to make more money off of it or profit, or one procedure is easier versus another. It really comes down to what is the most predictable, right? So here at our practice, we warranty our product. So if you don't have a good long-term result, you start experiencing issues, you having issues is not going to be good for us. And so that should be going on for every practice. So ideally, every practice that you go to will give you the most informed answer in regards to what would be your best solution.
In addition, the underlying bone needs to be sufficient quality and quantity to be able to accept the implants. Majority of people who need all teeth removed also have bone that is receded and infected. See, if bone is receded and 3-on-6 is done, the teeth will end up being longer to compensate for the lost recession of the bone. Implants are placed deeper where the bone is, and the teeth are therefore longer. That's a bad aesthetic outcome. Yeah, I don't want long teeth. I definitely don't want long teeth. Oh, and dentures are not an option for me. I don't want to have to deal with taking them out and cleaning them, or the fact that they just kind of like slip and slide in your mouth.
I don't know what website that she's reading this from. I wish she had documented that. But this website actually does bring up very pertinent information. So what will end up happening is if you have bone loss either originally before you have this procedure, what's going to end up happening is that they have to sink the implant to where the bone is. So that means deeper. And as a result, your tooth is going to be longer. That's what we call a FP2. So a lot of times people may be planning to do an FP1, but end up with an FP2, which is a longer tooth, which if you are smiling and you show more of your teeth, that's going to be unsightly, because you're going to have the whole expression of being long in the tooth is the fact that they're trying to talk about older people who just have longer teeth. So if you don't want that type of appearance, then that's not going to be the best solution for you. So they bring up a valid point. And I did want to say one other thing. It's not just the fact that you might have had teeth that have been missing for a few years, and therefore you had some vertical bone loss, and your teeth having to end up being longer. But another issue is that if during the process of extractions you lose some of that outside bone, the buccal bone or the facial bone, what ends up happening is if a practitioner, whoever's doing your procedure, if they're not going to be able to get a predictable, guided bone regeneration, building up a bone, the bone grafting, which when you're trying to reconstruct a facial wall, it's a little bit more difficult and unpredictable. What's going to end up happening as a result of that is that the implants can be sunk in deeper, and therefore, again, you're going to have a longer tooth. So that's something to keep in mind that a lot of patients don't know about.
You don't have to deal with the stuff that you have to put in the denture to keep it from moving while you eat and stuff, and food getting up underneath it. I do not want dentures. I want to be able to have teeth in my mouth all the time and not have to worry about like what I'm eating. Like if you try to eat something hard with dentures or chewy, your dentures are going to pop out, and I don't want that. And I don't want long teeth. That's what a 3-on-6 is saying. Stability and reliability. 3-on-6 is less stable, especially if one of the implants fail. With 3-on-6, you have 3 separate bridges supported by 2 implants each. Imagine one of the implants in the middle fails to heal. Since the 4 teeth of the middle bridge cannot be supported by just 1 implant, you now have the whole middle section of 4 teeth missing. Not a good outcome aesthetically.
That's a very valid point, because what's happening is that with the 3-on-6 design, you're using 6 implants, right, to support all 12 of your teeth. So you have 2 implants supporting 4 teeth. I personally wouldn't do that in my mouth, because when you're biting down, you're putting a lot of force on your teeth. And so if, I would do at least 8 implants. And the reason being is that I want 2 implants supporting 3 teeth, not 2 implants supporting 4 teeth, because you'll have a lot of force coming down on those 2 implants. And so you could reduce some of that force by having more implants distributed, all the force being distributed amongst more implants. So they bring up a valid point. So during the procedure, if you were to basically have your teeth taken out, when you place your implants, the ability to get what we call primary stability is going to be more difficult if you are going with a traditional arrangement of how you're placing your implants. And as a result, long story short, after your surgery, you're more likely to end up in a denture because you're not going to get primary stability for all your implants that are in your mouth. And therefore, because you're not going to go home with something screwed in, you're going to wear a denture for at least 4 months, like probably around 4 months. Now, every case is different. Some people might have very dense bone. But from my what I see higher predictability with an all-on-4 type of procedure if you're wanting to try to go home with teeth that day. That's what my finding is based off of doing implants for so long and doing some of these different types of options, implant bridges, FP1, FP3. So if you are a patient that wants to go home with teeth in your mouth that day of surgery, FP3 all-on-4 is going to be more predictable. Now, when it comes to kind of like discussing like in regards to like implant failure, the issue with P1 type of solution, and this is not just 3-on-6, you're specifically, if you're doing implant bridges, you need to pick specific spots where your dental implants are going. For example, you'll want to go in for a 3-on-6 type of option. You're going to want to go in with your first molar to your canine. You have to use those sites. You don't want to be going to other sites. Now, whenever we're doing these types of procedures, some of these other sites, like for example, your canine site might not be a great option because when we're taking your teeth out, you might lose a lot of bone on that site. You might lose interproximal bone, all these things. So again, it's harder to get predictability because all-on-4 or a FP3 type of solution gives you a little bit of leeway that you can actually change which site you're actually going to drill into to place your implant. Again, you lose that flexibility with a FP1 type of solution.
Now imagine the same scenario with the middle implant fails on an all-on-4. That's not a problem because the one solid bridge can still be supported by 3 other implants while the replacement middle implant is placed and is healing under the gum. With a 3-on-6 surgery, it's harder and it's less likely to have the teeth the same day. With 3-on-6 implants, the surgeon places implants into newly created teeth extraction sites. The bone is softer and often infected even after the infection is cleaned out. The implants are still placed into the softer bone, and it's much harder to get the implants to be stable and solid enough to have the temporary teeth attached to them the same day.
Okay, so I jumped the gun, and she actually is finding out for herself right now that yes, it's just harder to get what we call primary stability when you're doing an FP1 type of solution, and therefore, again, you are more likely to end up in a denture. If you load and you put the temporary teeth on that day, and in the event that those implants fail, then you are now in a predicament because, again, those implants need to go into specific spots for those implant bridges. But if you come back several months later and you have a failed implant, now you got to take that out, then you got to clean it out, you got to bone graft it, let it heal for several months, and then you can go ahead and place another implant. Some people might choose to do another way, but that's going to result in a non-ideal result. So
3-on-6, you're not going to get the teeth the same day. With all-on-4, on the other hand, the implants are placed deeper into the denser bone with a higher likelihood of achieving needed stability to allow the patient to have fixed teeth in the same day as the surgery. So all-on-4 is already sounding like my better option so far. For one, I don't know if I would meet the strict criteria for a 3-on-6, but with an all-on-4, you're telling me I can get all my bad teeth out and then have new teeth in one day. That sounds amazing to me. Then I won't have to deal with pain, difficulty eating, cold, hot food, and as I said, I can't chew on this side.
So basically, yes, if you want to go home with teeth that day, you definitely have way more predictability with the FP3 type of solution versus the FP1.
Had dentures for a while, you are going to be missing bone and gum tissue. So 3-on-6 is not an option at all. Even just wearing the dentures for a short period of time results in bone resorption and gum shrinkage.
Yes, so if you've been missing any teeth or missing all your teeth and you've been in a denture or you've been wearing a partial, whatever it is that you've been experiencing, then yes, you are definitely not an ideal FP1 type of patient because then you would need additional bone grafting to be able to place the implants to where they need to be. Also, a big repercussion of that would be that the shape of the teeth would have to be more squarish because you will be missing interproximal bone and the papilla. So therefore, long story short again, aesthetically, you are going to be compromised trying to go with an FP1 versus an FP3 type of solution.
If you still were to opt for a 3-on-6, you would have longer teeth and the implants are placed higher on the top and lower on bottom because that's where the bone and gums are at the time of surgery. If you start out missing teeth and gums, it should be replaced with teeth and gums, all on 4, in order to aesthetically rebuild your smile. If you do a 3-on-6, you'll end up with really long teeth in an attempt to compensate for the bone and gum loss and ending up looking unnatural. I definitely want my teeth to look natural. I want to have a natural, beautiful smile. I don't want long teeth. I have short teeth as it is. And I don't want my gums to be like way up here and I'm just like all teeth.
I wanted to say and accentuate not only long teeth, but squarish teeth. And the reason is again, because you don't have the peaks of gum coming between your teeth, the papilla, because this patient, whoever hypothetically, would have lost their interproximal bone. So therefore, just keep in mind, you're going to have very squarish teeth, which aren't very attractive.
Hygiene's more challenging with a 3-on-6. With 3-on-6, you have 3 separate bridges with highly uneven surface to mimic natural tooth anatomy. Trying to clean under those bridges is hard, and it takes a lot of manual labor to be able to do it well and keep the gums healthy. On the other hand, cleaning the uniformly even undersurface of the All-On-4 bridges is technically easier. I definitely don't want to have to deal, that's kind of like, I've never had braces, but like people with braces they can only eat a certain thing and they have to use that brush in between their brackets. That sounds like way too much work for me.
Okay, so I don't necessarily agree with what, again, I wish I knew what website she was reading. I don't necessarily agree with this. I don't think that FP, like All-On-4 FP3 is like easier to clean than FP1. I think that if they're both well constructed, and so what I mean by that for is a FP3, like a All-On-4 type of prosthesis, there's an argument of what we call concave versus convex. If you create a convex, what we call intaglio surface, meaning the surface that contacts the gums, then you're going to have a lot of food debris that can potentially get caught in there. Also, if you've seen some of our other videos, but what can happen is that if you get your All-On-4 final prosthesis too soon, then you can have gaps and all these things. And so that contributes to creating a less hygienic environment and making it more difficult to clean. I find that a FP1 can be easy to clean as long as, again, it's done properly. So I don't think, but if you were to ask me, again, trying to show you that, guys, I'm not biased, I do feel that, I think that number of All-On-4 that versus, 3-on-6 that's happening out there is like 100-to-1 ratio. There's way more All-On-4 in the world being done than 3-on-6. So you will see more opportunities where you see providers who may not know what they're doing or not doing proper designs. And therefore, when you see a case like that, then you can easily go online and find like a horrible case of just a disgusting FP3 type of solution. But whoever wrote this website, I don't feel like it's necessarily biased. I feel like it's a little biased to favor the All-On-4.
I'd rather just like brush my teeth, you know what I'm saying? Brush them like I typically would do. For 3-on-6,
you would just brush your teeth and water pick both solutions.
They may not be possible due to anatomic factors such as large sinuses. Our sinuses are above our upper teeth. That is part of our anatomy. Sinuses extend from upper molar teeth, sometimes as far forward as canine teeth.
She's bringing up an important point during her research that if we need to place an implant on your first molar, that, because we're doing a 3-on-6 type of design, that is very difficult to achieve without doing a sinus lift. I find way more often than not that a patient would need a sinus lift in that area. And when you do an All-On-4, you can have a 1-tooth cantilever up top, so you can actually place that implant on the second premolar, and have a 1-tooth cantilever. If you're doing an implant bridge or FP1 or a 3-on-6 type of solution, and you're having 2 implants supporting 4 teeth, that is definitely not going to be ideal by placing an implant on a premolar. You need to place that implant on the molar, and if you do that, then more often than not, you need a sinus lift, which is going to be more time and more money.
That means is that the sinuses take up the space of the jawbone and limit the length of the implants that can be placed with 3-on-6. If only shorter implants can be placed in the back because of a large sinus cavity, the back bridges will not be as well supported. That is not an issue with All-On-4 since the implants are placed with an angle to avoid the sinus cavity and give more support to the bridge toward the back. 3-on-6 is not looking good. It's already such like strict criteria and already so many like problems right here. So now I'm going to go.
So with the, I wanted to emphasize, so what she was talking about in her research, she was finding out that you can place some tilted implants that are parallel to the front wall of the sinus. So what that allows us to do is that can help get longer implants in there that are going to make it more sturdy. And again, because it's one single unit with cross-arch stabilization, that will be able to be, that's why you can have a cantilever on the All-On-4 versus the 3-on-6, which is broken up bridges.
Look, that was mostly about like 3-on-6s and why they're bad. Let's look at All-On-4s. So what are All-On-4 dental implants? An All-On-4 system is a combination of different dental methods and technologies that provide a solid and secure connection for the replacement teeth that is much more stable and reliable than traditional methods for fixing dentures, such as simple natural suction or denture adhesive. All-On-4 uses a set of fixed dental implants that are embedded in the patient's jaw in order to provide a firm and solid platform that holds the set of replacement teeth in place. Because of this, All-On-4 are often also referred to as a type of implant-supported dentures, although this is a broad term covering other styles of replacement teeth as well. All-On-4 are slightly different from a normal dental implant, which is designed to replace an individual tooth. The portion of the implant that is affixed inside the bone of the jaw is essentially the same, but the top exposed portion of the implant replaces the artificial tooth of a regular implant with a specialized cap-shaped tip. These 4 tips are used to provide a physical connection between the jaw and artificial teeth, which has a matching set of 4 receptacles on the other side. It's a solid physical connection between the implants and the new teeth that provides a much more natural feeling for the patient wearing their teeth, especially when chewing or talking. So I definitely want something that is going to feel more natural, especially when I'm chewing or talking, because I cannot wait to get back to crunching on like pickles and stuff like that, or chewing a steak even.
I think, a 3-on-6 and an All-On-4, or FP1 or FP3, they should both feel very natural. But I mean, I feel like you have to be a lot more careful. Like, I feel like you have to be a lot more careful in regards to implant placement with an FP1, like a 3-on-6 type of solution, or things can go very wrong. I think FP3 or All-On-4 solution has a lot more flexibility to avoid things going wrong. But as a result of that, what can end up happening is All-On-4s can be bulkier if you don't know what you're doing. So if you're not getting the implant positioning perfect and the multi-unit abutment positioning perfect, then patients can experience one of the chief complaints for All-On-4 is a lot of bulk. So, that can then make your teeth feel more unnatural. So this is why it's super important to go to somebody who does a lot of All-On-4 and really knows what they're doing.
Once the implants are securely in place, the implant-supported dentures can be used immediately, providing a fast recovery time and a quick return to your daily life and usual routines. So that's amazing. You're telling me I can get all my teeth out, get them replaced, and not have to deal with any pain. Well, a fast recovery time, so I can get back to eating pickles and chewing steak.
That's different for everybody. Whether you're doing an FP1 or FP3, All-On-4 versus 3-on-6, everybody's recovery. And so, like, again, this is why I hate websites like this. They make it seem like the procedure is so simple. Yes, some patients are not swollen at all and they're fine, like a few days later. And then you got other people who are really sore for weeks. So every case is different. So, to trivialize any sort of discomfort afterwards or like super easy recoveries, that's not realistic.
There are numerous advantages of an All-On-4, both directly related to your oral health and indirectly as they provide benefits in other areas of your life. An All-On-4 prevents bone loss and degradation. One of the most common effects of lost and missing teeth is the loss of bone in the jaw as a result. All-On-4 system is effective in minimizing the effect of bone loss since the implants are fixed directly to the jawbone and cut in a similar fashion and act in a similar fashion to the roots of natural teeth. Even in patients that have experienced some level of bone loss, the All-On-4 system can still be used since the implants provide such a secure connection to the existing jawbone. There's a substantially reduced likelihood that a bone graft will be needed in order to proceed. By avoiding the need for a bone graft, recovery and treatment timelines are significantly reduced.
Now, some people think that we never do bone grafting with All-On-4s. We still do bone grafting. So did an All-On-4 this morning, upper and lower, and there was quite a few areas that I decided to do some added bone grafting. Now, what we're saying is that the chances of you having to do a bone graft and then wait 4 months, then place your implant. So yeah, there's way less chance of that. But to say that patients think that you never have to add any bone grafting, that's not realistic. You're always going to get a better result if we have to add bone in there in certain areas, especially where your implants are.
It's going to improve your self-confidence. natural looking teeth, comfortable in the mouth, enabling them to enjoy all their favorite foods in a great variety of foods and drinks without the worry. That's what I want. Knowing that your teeth will stay in place at all times, patients experience a great boost in their self-confidence as they no longer need to be concerned about situations where loose dentures may be a source of embarrassment. That's just what I was talking about earlier. You see what I'm saying? I'm not trying to eat a piece of gum or bite into an apple and my teeth fall out. That's embarrassing. And I'm fairly young too. And honestly, I want people to think I have all my teeth. Easier care and better hygiene. Follow normal oral care habits that you're already familiar with. Brushing, flossing, oral rinses, dental checkups are still necessary. All-On-4 has the added benefit of doing away with the needed for any messy or costly adhesive that are commonly required with the other traditional styles of dentures. Saves time, hassle, and money in the long run. Everything I was mentioning earlier. It says right here, I'll show you guys. It's important for patients who are missing teeth to understand that the more time that passes before they receive treatment, the more likely they are to risk developing conditions as a result, such as gum recession, bone loss, or other oral health concerns that can become serious if left untreated. Take action early to replace missing teeth if you are investing in your overall health and well-being and will avoid these potential problems in the future. So this website is already convincing me. Just researching this is already convincing me that I might just want to do this sooner rather than later. As I mentioned earlier, I already lost this tooth, so I'm definitely already thinking about getting an All-On-4. We learned about 3-on-6, All-On-4. What I want to know, how much they cost. So a national average cost for 3-on-6 implants can range broadly, typically between $22,000 to $44,000. Price covers the entire procedure, including implant, surgery, and the final denture. So for All-On-4, it's saying immediate teeth start at $13,500 per arch, includes the surgery and immediate fixed healing All-On-4 rate.
So, I mean, if someone's offering a 13,500 All-On-4, that's a bait and switch. And what they're doing is, what you'll see with a lot of marketing out there is they'll throw like kind of like a starter fee out there and then get you in to come in for a consultation and be like, oh, well, that's not including your final teeth, zirconia. If you want this, you got to pay extra for this. You want bone graft, you want to pay extra for that. Oh, by the way, you need 6 implants instead of 4, so you need to pay more for that. Oh, you wanted anesthesia, you need to pay more for that. So, everybody is kind of like functioning on their own little like you know how they whatchamacallit, they kind of like diagnose what you need and therefore what your cost should be. So just be wary of that. And also just another thing you should be concerned about is go to someone that's going to give you the solution that's going to get you the best outcome. Don't necessarily go to somebody who's just going to place 4 implants and place only 4 implants when that might not be the best solution for you. Sometimes those 4 implants can be great for some people because the good bone density, good bone anatomy, small sinuses, nice thick bone, nice high bone. But again, there's so many factors that come into play that makes a person a great candidate versus a person not a good candidate. And if they are lesser of a candidate, what can we do by adding more bone? What type of prosthesis, all these different options that come into play that start manipulating the cost. So when you're doing your research and people are just kind of like throwing out blanket statements about what the cost is, it's very biased and not true is what I find a lot of times.
How many arches are there? I guess just 2. So that brings that to 26,500. I also want to know how long a 3-on-6 would last. So for a 3-on-6, they last 20 plus years. Now let's look at All-On-4 implants last. This is saying, generally speaking, on average, All-On-4 implant supported dentures tend to last around 10 years. So that's
okay. So I mean, so this is extremely frustrating for me because this is all just like BS just being thrown out there, quite frankly. I mean, so if you come to the engineering standpoint, you're going to have, you know, the way that an All-On-4 or a 3-on-6 is going to last longer is going to be based off of how much stress those implants are going to be, right? So here in Texas, we have foundation issues because of the type of soil that we have. So that foundation is going to dictate how long your house is going to last. Because if your foundation is not right, your house is going to have issues. So similarly, your implants are the foundation for your teeth on top, your prosthesis, right? So whether you have 3 individual bridges like you do on a 3-on-6, that's the prosthesis versus a single unit arch, which is going to be the type of prosthesis for an All-On-4 FP3 type of solution. what's going to happen is that when you have a single arch, due to the physics and engineering of what we call cross-arch stabilization, having one single arch, what happens is you basically decrease the amount of stress that you have on those implants, which is a good thing over the long haul. So when you have that less stress, again, this is no attack on all on a 3-on-6 or anything like that, but FP1 segmented individual bridges, that if you were to now compare that in the stress on those implants versus All-On-4, you're going to get way less stress on your All-On-4 dental implants. So therefore, you're going to have a much better chance of surviving and not having issues with your All-On-4 in the future by having that cross-arch stabilization. Now, if you do a FP1 type of solution, like a 3-on-6, again, I would say try to avoid doing 2 implants to support 4 teeth. Try to get 2 implants to support only 3 teeth, because again, you're going to then have less stress on each implant. And less stress on the implant means a better chance of that survivability of that implant in the future. So then when someone's coming out here and saying a 3-on-6 is going to last 20 years versus All-On-4 about 10 years, that has no scientific bearing. That's not what research is showing. So again, what website are we reading from? Because that's very skewed.
Looking good. Let's see if we can find another statement supporting that one. I definitely want it to lie. I don't want to be 30 and have to do it again. This one down here says All-On-4 implants can last a lifetime with good oral health. Right now I'm just clicking on all like the Google questions. I clicked on another question about cost again.
So let's actually talk about, she did a little bit more research on, how long will it last. So I think some of the most important factors are going to be like, going to somebody who knows what they're doing with these types of procedures. Make sure that if you have less bone than other patients, that you're going to be a more challenging case. So you need to go to somebody that has a lot of experience, a lot of surgical experience, making sure that when they're placing the implants, they're going into the precise positions that they need to be, and also the right dimensions, right? Some patients, like some doctors, have a tendency to oversize the implants. And if you have oversized implants, you're going to have issues over the long haul, because you're going to start having dehiscing bone, you're going to have gum recession as a result, you're going to have periimplantitis, and so therefore you're going to have a ticking time bomb within your mouth, because you're going to have issues with those implants one day. So those are some of the factors that come into play. And also, how good is your hygiene? Are you taking good care of it? Are you water picking? Are you brushing your teeth? And are you getting your annual maintenance? Some people who are not doing a good job, or they build up more bacteria in the mouth, maybe they need to get maintenance twice a year. So these are all things that come into play in regards to how long your teeth would last.
Said 25,000 per arch. That's like double the amount of what I stated earlier that I found. This is who is a good candidate for an All-On-4. Current denture wearers make particularly good candidates as they...
Before we head into the candidates thing, I wanted to hit the cost one more time, because it's always a huge question. Again, she was finding out that she's finding average cost for an arch is 25,000, but wait a second, earlier I was finding about 13,000. And so the reason, again, comes down to marketing gimmicks. So just understand, different costs with number of implants, anesthesia, any additional bone grafting, type of prosthesis. Hey, who's doing your surgery? Because if you got somebody that's a specialist or highly trained or knows what they're doing with these and a lot of experience with these, and they have, their own lab, their own mill, their own prosthodontist, their own surgeon, everything under one roof, so those people are probably more qualified to being able to do these types of procedures. And so the costs associated with them, hey, maybe you might see a higher cost with those because they really know what they're doing. But also, if they're doing a lot of these cases, maybe it gives them the economies of scales where they can bring down the cost a little bit, right? So there's so many different factors that come into play, but just be very, very aware. Don't just be suckered into seeing that, hey, this place is, here in Dallas-Fort Worth, we have someone that's advertising All-On-4 for $10,000. And because it's a small community, you see a lot of patients that go into consultations everywhere, and they tell you exactly, yes, that did not include everything. There's a bunch of things that if you want to add on the things that everybody would realistically want to add on anyways, their fee basically doubles. So that's just something to be very aware of.
Find that unlike conventional dentures, All-On-4 implant supported dentures will not slip or shift out of place. They emerge from treatment able to bite, chew, speak, and smile with renewed ease and confidence. We looked at what the difference was and that there were stricter criteria for the 3-on-6 and the complications for 3-on-6. We looked at what is an all-on-4, how do implants fail. 2 main reasons dental implants may fail: peri-implantitis and failed osseointegration. Peri-implantitis happens when you don't take good care of your teeth, including brushing and flossing. It's a form of gum disease where the infection harms the bone. Infection is the #1 reason for dental implant failure, which can usually be prevented with proper dental implant care. Other causes of implant failure can be avoided by choosing an experienced implant dentist. Poor placement and inadequate patient screening can be another reason for an implant failing. When would they fail?
So I don't know what she's going to say next, but like, let's talk about implant failure. If you're asking me FP1 versus FP3, what's going to be more prone to implant failure, I'm going to say FP1. The reason is that when you're doing FP1, your teeth and where they're supposed to, like your implants and where the abutments are and where your teeth are supposed to be, you have to be very, very, very careful with how you place your dental implants. Again, like I said, not to toot my own horn, I placed like 10 to 15,000 implants in my career, but when I'm doing an FP1 type of solution, it raises my stress up fivefold. And it's because we have to be very, very careful about the implant positioning because things have to go perfectly. If they don't, then this patient can start experiencing bone loss, buccal bone dehiscences, all these types of issues in the future. Yes, I could always bone graft, but again, you lose a little bit of predictability when you're trying to regenerate all that bone. And there's so many things, again, that are out of my control. How thick is that patient's bone in the first place? What type of, biotype did they have, right? A thick biotype or a thin biotype? How did the extractions go? So again, there's many factors that come into play. But let's also talk about, again, another aspect of your, losing an implant. What she's talking about here is going to be overloading the implant, meaning that implant getting too many forces on it. So if that's the case, then if you're doing 3-on-6 and you do 3 individual implant bridges supporting 4 teeth, each, then you're going to get a lot of force on each implant. And the other thing that FP3 all-on-4 type of solution provides that a FP1 individual implant bridges doesn't offer is, again, this cross-arch stabilization. It's all one unit, and therefore you get less stress on each individual implant. So that's a key factor of what can cause implant failure. So if I was to put money on the fact that a patient was to experience, they were like, hey, listen, I can't have an implant failure because that's just not acceptable and my time won't allow and all these things, then if that's the case, then I want a patient to understand that an FP3 is going to be a better option for them.
Within the first 3 to 4 months of the procedure. Let's go to YouTube. So I'm typing in what is the better option, 3-on-6 or all-on-4.
What are your guys' thoughts?
So before I continue on with this video, I did just want to show you guys what I ended up clicking on. I typed in what is the better option, 3-on-6 or all-on-4. So
she ended up watching one of our other videos.
Looking at dentists discussing all-on-4 versus implant bridges, which is the 3-on-6. And I'm going to watch this video and pause it frequently to kind of discuss what I just heard and what I think about it, and if I have any questions over it.
They need to have a replacement of the full set of teeth and gums.
So you're talking about.
So she's saying the advantages are that you get to keep your real gum, show your real gum, and that if a piece breaks, you're only replacing that piece, not the whole bridge.
Yeah. So she's talking about a 3-on-6 for that type of solution, a FP1.
All the next is going to be much more straightforward and a very shorter period of time that she has to.
Okay, so they're saying that with 3-on-6, when you get the surgery, it's going to last longer because you have to take all the teeth out, deal with gum recession, bone loss. I guess the healing time's quicker, and with the all-on-4, it's very straight to the point. A lot of times you will get your teeth the same day. What would a dentist put in their mouth? So I'm still not finding anything on what a dentist would do in their mouth. I would just ask Dr. Choi that later. I'm going to ask him what would he do. So I'm going to look at success rate of the 3-on-6 first. Immediately, it's showing me 3-on-6 implants have a success rate of up to 95%. And if taken care of properly, they can last a lifetime.
95%. Dental implants have a 95% documented success rate. But that's oftentimes when you stage everything, meaning you take out your teeth and place the implant, you let it heal for 4 months, then you go in and do an uncovery. So that has a higher predictability success. When you're doing a 3-on-6 or an all-on-4 type of solution, we're trying to do everything one day, you put a lot of eggs in one basket, and therefore you're increasing your odds of something going wrong. You're making that higher. Now, after you've gotten through that 4 or 5, 6 month healing period, whatever your doctor decides is best for you, At that point, if your implants don't have bone loss, they're fully integrated and they're having no issues, then yes, your survival in the future is going to be super high. It's all about just making sure that those implants can heal with no issues. And if you ask me again, you're going to have a higher chance of success and less failure if your implants are going to have less stress on those implants. That is something that cross-arch stabilization with an FP3 or all-on-4 type of solution, single arch, is going to be able to give you better than segmented bridges that you have with FP1 type of solution.
And success rate of All-On-4. So an All-On-4 dental implants have a high success rate, with some studies reporting rates as high as 99.2, a lot more.
Okay, so I do want to say one thing about that. There's way more studies about All-On-4 versus 3-on-6, because again, 3-on-6 was a protocol invented, I think, like 7 years ago, something like that. And it's just kind of like a marketing spin of what FP1 is. But All-On-4, if you go to a clinician, like if you're asking what's happening FP3 or FP1 all over the world, it's hands down like multiples, like probably like a 20-to-1, or 50-to-1 ratio of, FP3 versus FP1 happening out there. It's like single arch, like All-On-4 versus like implant bridges. So therefore, you have way more studies on it, right? Now, I wanted to say something about this 99%. Like, what study was that, right? And what time period are they looking at, right? Are they looking at 1 year, or are they looking 5, 10? So there's so many studies out there. Like, some of these studies are going to be what we call longitudinal. They follow these patients over the years, right? But All-On-4 was invented in '98. And so some of the things that we have to look at is what are the studies out there that are like the longest longitudinal studies that we have out there talking about All-On-4. Now, 3-on-6 is only, again, like a 7-year-old protocol. Now, if you want to broaden that out, let's look at all the FP1. Like, what are all the studies of FP1 out there? But more of the studies that you'll find on FP1, you'll probably find that they have the bridges supported by 2 implants supporting 3 teeth versus the 4 teeth that they're doing in this. So, something to think about.
Successful than 95. If you're going to spend so much money on an implant, I'm going to go with the one that's has a higher success rate. Go over the recovery and aftercare. After the implants are placed, patients typically have a 3 to 4 month healing period before final restorations are placed. During this time, patients will have temporary bridges and removable denture. Follow your post-op instructions, take your medications, avoid certain foods, and maintain your oral hygiene, which helps you avoid complications and speed up recovery. Take care of your implants, avoid putting too much pressure on them, and smoking, which can hinder your healing. Protect the surgical site. Bleeding is normal and may last for several hours. You can apply gentle pressure with cool packs to your cheeks, jaw, and chin. If you have a removable denture, you can place gauze in the molar region and bite down. You should also avoid spitting, bending over, sucking through a straw, and rinsing for 24 hours. Eat soft foods for the first 24 to 28 hours. Avoid straws. After that, you can eat soft foods that don't require chewing. By the second week, you may be able to eat soft vegetables, rice, and eggs. As your mouth heals, you can gradually reintroduce firmer foods and eventually return to your regular diet. Avoid spicy or hot foods that can irritate your gums and slow healing. Just get enough rest. Don't do any strenuous activity, and make sure you go to your follow-up appointments. Most patients feel good enough to return to work within a couple of days after surgery. After the implants are placed, you will generally require a 3 to 4 month healing period on a soft food diet for the implants before your final restorations are placed. For a 3-on-6, you're looking at a 3 to 4 month healing period where you're on soft food diet the whole time. I don't know about you, but I do not want to eat soft foods. I like the crunchy food. I like pickles. I like steak.
I mean, I hate to break it, to her, but I mean, whatever solution she chooses, she's just gonna have to be on soft diet, whether FP3 or FP1. One thing I will say is that if you are on a FP1 type of solution, and chances are you're gonna have to wear a denture because you're not gonna get that primary stability, then honestly, yeah, you'll be soft for that first month. But I mean, the problem is that you'll be wearing a denture and you can't really be eating pickles or steak with a denture, right? So, but even if you're in an All-On-4, like a FP3 type of solution, and you got your teeth, don't get too excited about that and think that you can go eat pickles and steak. You're going to have to stick with the soft diet.
Even chicken's kind of chewy sometimes. I'm not liking the sound of that. Let's look at All-On-4 recovery and care. It's saying rest at home for the first 72 hours, elevate your head while sleeping, get plenty of rest. Swelling and bruising, apply ice packs to the affected areas for the first 48 hours to reduce swelling, and avoid hot food and drink, smoking, and alcohol, which can make swelling worse. You might also experience dizziness or lightheadedness if you had general anesthesia or IV sedation. So have a responsible adult stay with you. Take your pain medications. For the first week, stick to soft foods and liquids that require minimal chewing. Once you're fully recovered and have your permanent artificial teeth, you should be able to eat most of the foods you did before. Avoid strenuous activities and restrict your activities the day of surgery. You can resume normal activities when you feel comfortable, but it might take 7 to 10 days before you can eat normally or participate in strenuous activity again. This is saying 7 to 10 days before you can eat normally. So that's 7 to 10 days versus 3 to 4 months. So that's
Soft diet. Soft diet, soft diet. Do not listen to that.
a very quick recovery time. Let's see. I'm going to look it up one more time.
What's driving me crazy, like I mentioned earlier, is like you're going to see so much skewed information out there. It's trying to like sell people on their product.
Looked up 3 on 6 recovery time again, and this one is saying 3 to 6 months. All-On-4 2 to 6 months. One thing we didn't go over is risk.
Inconsistent information all over the place. So, which is what is like, you know, the reality.
Risk for 3 on 6. So right here it is saying implant failure. The 3 on 6 approach relies on 2 of the 3 prosthetic pieces on the posterior maxilla, which is considered one of the weakest bones in the mouth. This can lead to implant failure, especially if one of the implants in the middle fails to heal. Stability. 3 on 6 implants may not offer the same stability as other options, especially if one of the implants fails. These implants are placed deeper in the bone, which can make the teeth longer and less aesthetically pleasing. Upper jaw implants and anatomical factors in the upper jaw, such as large sinuses, can limit how long the implants can be. This can lead to back bridges that lack adequate support. This dependency poses potential long-term risk, including the possibility of implant failure, thereby warranting careful consideration by both practitioners and patients.
This is something that's very important. I bring this example up all the time is like, you need to think about your, you know, All-On-4 or 3 on 6, kind of like a house. You know, you can buy a house, you'd be excited, you walk in, everything looks great, new paint job, kitchen looks beautiful, bathroom looks beautiful. But what's lurking behind those walls? And what's lurking behind those walls may not give you issues for a few years, maybe 5 years, but now then you have significant issues. You have plumbing issues that then require you to tear out your flooring and also doing work into your foundation. Similarly, the same thing can happen with the All-On-4, right? Or a 3 on 6. So how well it's done is like super important. Now, what she's doing research on right now, she's talking about the posterior upper jaw. So that's the softest bone that we have in your mouth, right? So it's type 4 bone typically. So when we take a tooth out and we're trying to place an implant there, there's 2 main things that are happening against us. The 3 on 6 or like, you know, a 3 on 6 or FP4, FP1 type of solution is going to require that we place an implant on that first molar site. Well, one of the biggest issues back there is that more often than not, you're going to have low sinuses. Your sinus is just an air-filled cavity. So if I'm placing an implant in part bone and a lot of air, you're only getting that support from the part of the implant that's buried in your bone. So number one, if you're only getting that much support, right, for this implant that's this long, and then also I just told you that that bone is also soft, then what is the chance that that implant is going to survive, especially if I'm trying to load your teeth that same day, meaning you have your teeth taken out, you place an implant, and you're going home with teeth screwed in, not wearing a denture for 4 months, right? So you're going to have a lot less likelihood of being able to have like screwed in teeth that day versus like a denture. But even also in the future, when you have those 2 implants supporting, again, the 4 teeth that keep on bringing this point up, and also that softer bone, you got to think that's more like drywall or sheetrock versus a stud. So therefore, you do have a chance for something going wrong. Now, also imagine that you have very large, strong masseters, right? Let's also say you may be a clincher or grinder, which 80% of the population is, but they just don't even know it. Now you're throwing a lot of eggs in this basket where you have a higher chance of having problems in the future.
Look up the risk for an All-On-4. All-On-4 has a lot more risk. So the implant failure, and what can increase implant failure is bad oral hygiene, teeth grinding, and smoking. Infection, sinus complications. If implants are placed in the upper jaw, they can sometimes penetrate into the sinus cavity and cause issues, bone loss if poor hygiene isn't maintained after surgery. And with peri-implantitis can lead to bone loss. Gum recession. This can be caused by incorrect implant placement, smoking, poor oral hygiene, gum disease, or teeth grinding. Nerve damage. Although rare, there's a risk of nerve damage with any dental surgery, which can cause numbness or tingling in the lips, tongue, or face. Bite misalignment. The implants are designed to feel and function like natural teeth, but incorrect placement can cause issues. Adjusting to new teeth. The transition period with temporary teeth can take time, and there may be complications and increased risk of failure. If you cannot get...
Well, that's a lot of, like, a laundry list of complications, but those complications are actually, applicable towards both FP1 versus FP3, All-On-4 versus 3-on-6.
Use them quickly and you're messing with them all the time, that is where I can see it being a risk. Because if you're messing with it all the time and irritating it all the time, then I can see that there will be an increased risk of failure. Other risks include expensive costs, surgical risks like bleeding, health conditions that slow the body's healing process, improper planning before placement, poor quality construction, unreasonable patient expectations, inadequate care after installation. Okay, I was just going to type something and it said All-On-4 regrets. So let's look at that.
If you want to know more, check.
So what she just said really got to me. Just make sure you're choosing a good provider who has a good reputation with a focus on dental implants. And if we're going for All-On-4, more specifically All-On-4 dental implants. Because let me go back and show you guys what she was saying about the patient that came into them that had an All-On-4 in 1 day. Whoever was marketing to her was saying that she could get her teeth in 1 day. Doing your research is 100% a big deal, and finding reputable doctors to do that.
Okay, I guess that's, yep, she's all done. So yeah, I don't, let me scroll back a little bit and see like what the heck she saw right there.
Because let me go back and show you guys what she was saying about the patient that came into them that had an All-On-4 in 1 day.
Okay, yeah. So what we see right here are the multi-unit abutments and a lot of bone loss. So I think that they actually designed it this way to make it more hygienic, which I'm not a big fan of, by the way. So sometimes you will see prostheses made like this. Others are where the actual teeth are supposed to be seated down, resting against your gum. Now, people who have really poor oral hygiene, this is why we would see something like this. But I'd be interested in watching this video and kind of giving a reaction to this. So final points kind of in regards to like all the questions that she had. One thing I want to tell patients when they're doing the research is that understand that a lot of sites out there are very biased. It's going to be because some centers may be pushing more one procedure versus the other. Again, not to attack, FP1, like, 3-on-6 type of, providers. I do know that there's a lot of marketing that's going on behind the scenes. To do 3-on-6, you do have to go through 3-on-6 licensed providers and get their training. I honestly don't think it's anything, crazy. It's just typical FP1 segmented bridges. But, FP3 All-On-4 is actually just a protocol that's just been around, and there's no licensing fees or anything that have to be paid towards FP3 All-On-4. We are finding more and more providers trying to go out there and doing some of these surgeries, whether here or abroad. And so we are seeing more and more cases getting incorrectly done and patients having a lot of issues as a result of this. The whole purpose of this video is to make sure that you guys really go out there and do your research and understand that although any of these types of dental implant procedures can be fantastic and life-changing, they can also go very wrong and be very debilitating and result in just very extreme dissatisfaction with what's going on inside your mouth, and also just loss of money, pain, just affecting the quality of life, and a lot of things, can ultimately just result in a regretful decision. So when you're going out there, just please educate yourself as much as you can. Please seek multiple consults, and that would be honestly my best advice for you guys. So if you guys have any other questions, please feel free to leave them in the comment below. If you found this information helpful, please give us a thumbs up. And if you are seeking any other sort of consultation, feel free to hit the information below and give us a call. Thank you.